Hello again, this is Brandon Wiley with Physical Therapy Connections, coming to you again with another back pain video. Specifically, in this one, we're going to be addressing back pain with radiation type symptoms and giving you a few ideas, a few exercises that you can try out to see if they help with any of your back pain. So when I say back pain with low radiation symptoms, that means I'm talking about pain that generally originates either in the low back or hip and goes down the leg, left, right, or both. For this one specifically, or what I should be going into next is a lot of what some people with low back pain radiating symptoms get is actually muscle pain. So just like the heart, when someone has a heart attack, you hear, oh, my left shoulder, my neck, my jaw. Muscles have similar referral patterns to just like the heart. So one thing you want to check to make sure it's actually back pain, or if maybe it's hip pain is, you can take the ball, you can massage, you can put it behind your back, roll it around gently. If you find any tender areas, relax, let it sit there, and hopefully that takes the edge off. Hopefully you reduce some of those symptoms. Another thing, if it's not these large hip muscles that are causing some of this radiating pain down the leg, it can also be something called the nerve entrapment. Nerve entrapments are very common at the back, but they can also occur within the leg itself. Other common spots being right in the hip, right behind the knee, or around the outside of the knee, and then every so often down near the ankle. But if you're having those problems, there's another little exercise that we can do to help mobilize that nerve to get it stretching through the tissue, because sometimes tight muscle or as it goes through bone will like to snag on it so the nerve can't move. You get that pinching sensation. Might get a zinger, numbness, burning, tingling down the leg. And for those, one exercise you can do is you can start seating in a chair. You can start slumped, bring up the bad leg, and then sit up straight as you bring up the bad leg. If your symptoms are very, very intense and you get a lot of pain with this motion, you can point the toe as you sit up straight, and that should help a little bit. Another way you can do this is you can do this lying down. When you do it lying down, now it's on the ankle. So when you bring the leg up, you point the toe towards the ceiling, and you keep the toe pointed towards the ceiling as you bring the leg back down. Those are both called nerve glides. When you're doing them, you should not be experiencing any of your symptoms. Your symptoms should not get worse. If they are getting worse, then you either have to modify them or just don't do them. The last little one I want to give you, because it's very common amongst a lot of people, especially a lot of people with the quote-unquote sciatic pain, is a piriformis stretch. This is a muscle that goes, it's a deep in the hip here, and it goes right over the sciatic nerve. So a lot of times, if there's not an impingement of a nerve in the back there, that is the next or even the most common site for nerve impingement. So outside the soft tissue, you can also give that a stretch. You can either sit down, give it a stretch by pushing the knee away, or you can pull it towards the opposite shoulder. And you should get a pull through the back here. If you're getting a pull through the back here, or not getting a pull through the back there, I should say, you might have to modify the stretch a little bit. Note that this can be done in seated, or it can be done lying down, where I'm here, pushing down, or here, pulling towards this opposite shoulder. I hope these exercises help you with some of your back pain. If you've been trying them, they're not helping at all with that radiating pain down the leg, please come in for a visit, and hopefully sooner rather than later, maybe we can hopefully find the source of the problem and get you feeling better sooner. Have a wonderful day.